Welcome to Africa Express. Today we are going to Pennsylvania. We have with us a very talented lady. Her name is Dr. Henrietta Ukwu. She is an internist and an infectious disease physician. Dr. Ukwu, you are welcome to Africa Express.
Thank you.
You are visiting Boston today.
That's right.
For meetings and stuff.
That's exactly right.
Well, we're glad to have you in Boston. You've had quite an impressive career.
Thank you.
I was reading your bio. I was literally taken aback. I'm like, is this an African-American woman that has accomplished so much?
Thank you.
My question is, why medicine?
That's interesting. Well, medicine is a very noble profession, as you know. And it is a profession that my father would say, if done well, is a gateway to heaven, because you're literally working with the sick, those that are burdened with illnesses, and in your quest, you actually try to alleviate them of the burden of illness, as well as improve their quality of life. So it is a privilege to be in the profession of medicine, and even further an honor to practice it well.
You've been involved in development of so many drugs.
That's exactly right.
To be precise, say at least 14.
Yes.
And all 14 being approved, that's quite impressive. Could you tell our audience some of those those drugs that you've been involved?
Yes, it's quite a privilege to have gone from studying the practice of medicine and joining pharmaceutical industry, which I did in 1992 after my fellowship in infectious diseases. And that broadened my horizon and dimension of knowledge to take medicine from the bench, the science of it, to the bedside of the patients, and particularly being privileged to work with a lot of products in development. So my career started at Merck, and for the first 6 years, I was involved in developing a number of products. The first,
for the interest of our audience,
yes.
What is Merck?
Merck is a pharmaceutical company. Merck and Company Incorporated is a major pharmaceutical company, one of the pharmaceutical giants in the world, and is known for their research, development, manufacturing, and marketing activities.
Okay.
Now, so I was involved with the first product that has my name to it for approval is the chickenpox vaccine. That was approved in 1995, and it's called Varivax.
Really?
And so you can see that since 1995, most young mothers may not at this time be able to identify chickenpox, because children receive that as part of the immunization schedule since its approval in 1995. The second product was a real landmark, which was the HIV protease inhibitor called Crixivan. The protease inhibitors, when they were introduced in 1996, were very significant contribution as major armamentaria for treating HIV/AIDS. And actually, with the advent of introducing HIV protease inhibitors over the next few years, significantly cut the mortality of HIV/AIDS by about 50%.
Really?
And they, with other medicines that have come after them in combination, have turned around what would have been called an acutely fatal disease to a chronically manageable disease. Then the third one was a combination vaccine called Comvax, which was a combination of the Haemophilus influenza B and hepatitis B vaccines joined together. And that began the era of combination vaccines because we wanted to consolidate as many valencies into one injection, because children were receiving multiple injections in their all four limbs, the arms and the legs. Subsequent to that, there was another multivalent vaccine that had 6 components to it called Hexavac. And then after my period at Merck, I went on to Wyeth Pharmaceuticals, where I was vice president of global regulatory affairs and had responsibility across all the therapeutic areas and all the therapeutic platforms, vaccines, biologics, and small molecules. And there again were many other products, Tigersil, an antibiotic, primarily for skin and soft tissue infections and abdominal infections. Following that was an oral contraceptive, Librel. Following that was a product that we call Relistor, which is for opioid-induced constipation in elderly patients or terminally ill patients that are on a lot of opioids and they have constipation, and this helps alleviate the problems with constipation. Following that, and we could go on and on. There are 14 of them, all right.
Mesmerized by the whole thing.
and finally, the Prevnar vaccine, which is a 13-valent conjugate vaccine for children, particularly important because the invasive pneumococcal disease is a major killer in developing world and even in the developed world. Pneumonia, you know, is one of the leading causes of death, respiratory infection deaths in developing world, and the leading cause for deaths in children less than 5 years of age. So the Prevnar vaccine, pneumococcal conjugate vaccine, is a significant contribution, has made significant contribution to public health in general.
Thank you so much. That is, I know that we can go on and on and on with all this medicine. And I recently read an article that said that since the mid-1970s, the world has seen an emergence of about 30 new infectious diseases, and the return of cholera being one of them.
Yes.
What do you see as the reason for this new re-emergence of infectious disease?
Well, there are many factors. And you're absolutely correct. The WHO had, in fact, indicated that we've had about 30 new infections with re-emergence of what we had considered old diseases. It is considered the scourge of mankind, if you really think about it. Now, in the latter half of the last century, there were significant efforts with vaccines and immunization campaigns to curb infectious diseases, and many of them were actually curbed, if you would, to the point that smallpox was eradicated from the face of the globe about 20 years ago. And that gave us a lot of impetus and a lot of promise that many other infections could actually be either eradicated or eliminated. We haven't been quite as successful with other infections, and we've seen over this last decade and more a re-emergence of the ones that we thought were curbed. There are a number of reasons for them. So when we think about the bacterial infections, the introduction of antibiotics was a good thing. It was a major advance in medicine for the treatment of infections. However, the excessive use of antibiotics have also led to resistant strains. So these bacteria are no longer responding to the prior antibiotics and have mutated to even more virulent strains requiring new therapeutic modalities to treat them. We've also seen, as you pointed out, cholera. There's a lot of association with the natural disasters, drought, not just drought, but flooding, etc., that actually displace people, bring about a lot of crowding, overcrowding, and unsanitary conditions that expose them to these infections. There have also been emergence of new infections that were not previously recognized. Now, we know that HIV/AIDS is certainly one of the most feared ones. It was a new infection that started in the late 80s into the early 90s.
Right.
We also know that there have been other diseases like cyclospora that causes all kinds of diarrhea, hantavirus, Ebola virus, Clostridium, different species of Clostridium that actually, specifically the Clostridium difficile, that can come on with patients in the hospital. It's a nosocomial infection from high-dose use of antibiotics as well. So there are a good number of these diseases. Now, when you talk about the older ones that we know about, like tuberculosis and malaria, there have been many efforts to try to curb them, but with everything that we're throwing at them, they continue to remain.
There has been a major problem. That tuberculosis in particular has been a major problem in South Africa, ranking from 5th on the list of 25 high burden tuberculosis country in the world. Now, there's a treatment called DOTS.
Yes.
Has that treatment been made a change?
Well, yes. As a matter of fact, DOTS, DOTS is directly observed treatment, tuberculosis short course treatment, so DOT, directly observed tuberculosis short course treatment.
Okay.
And it's the directly observed, or the direct observance is really to observe the patients, take the medication, see them swallow it.
Okay.
The treatment course for tuberculosis is a very lengthy treatment. It goes anywhere from 6 to 8 months. And with the DOTS strategy, the treatment for sensitive, highly sensitive strains of tuberculosis would be a triple therapy for the first 2 months, and then a double therapy for the remainder of the four months. But if it's not a sensitive strain, it would be a quadruple therapy for medications called INH, isoniazid, rifampin, PZA, and ethambutol. And then they would continue the INH and rifampin for 4 to 6 more months following the first 2 months.
Why is the treatment so long? Why? What does it take so long? Why?
It's a very hardy bacterium. It's a mycobacterium, and it's hardy, and you can see we're using multiple therapy. You cannot treat it with a single therapy. So we're using multiple combination therapy to attack it from its various weak links, if you would, from its scientific makeup, its genetic makeup. So it's a very hardy bacterium.
So what is it about South Africa that make it peculiar? Why they have such a high rate of it?
Well, I don't think it's peculiar to South Africa particularly, frankly, because South Africa is rated 5th among 22 highly burdened countries.
Right.
So there are 17 more countries that are highly burdened, and a lot of the developing countries in Africa are included in that list. However, the emergence of HIV and the co-infection of HIV and tuberculosis have actually changed the dynamics of both diseases and have turned the sensitive tuberculosis to the more multi-drug resistant strain that makes it even more difficult to treat. And again, it is not peculiar to South Africa. It occurs in just about any part of the world, including the Western developed world, where the HIV and tuberculosis coexist.
So you're saying that the combination of both diseases even make things more difficult.
That's right,
in terms of treatment.
In terms of treatment, exactly, and in terms of the outcome for the patient, whether they live or die. That's right.
Wow. I have to ask this question because it's a speculation. So I wanted to hear from the horse's mouth.
Yeah.
There's been speculation that some TB medication has serious side effects, such as kidney failure. How true is this? Again, sometimes it's better off when there's this speculation to get to the bottom of it.
Yes. Well, certainly for all the patients that are put on medication, they need to be aware of the side effects. There's hardly any medication that does not have some side effect. Now, with the anti-tuberculosis treatment, the primary side effect is really hepatotoxicity, which is liver toxicity.
Right.
The primary treatment with INH, the isoniazid and rifampin can cause liver damage, and they're monitored fairly carefully. However, when we've just talked about the multi-drug resistant tuberculosis, we call it MDR-TB, those ones require a different set of treatment that we call aminoglycosides. So the streptomycin or amikacin may have to be used in this type of tuberculosis treatment. And the aminoglycosides are known to have, that can impair the renal function and damage the kidney. They have to be monitored very closely and very carefully. And patients that already have mild or moderate impairment of their kidney function probably should not be put on those kinds of medications. Those are the ones that may specifically be related more to the kidney than the liver. But the anti-TB therapy is primarily more around liver toxicity than it is for kidney failure. Yes.
So basically, when it comes to tuberculosis, if one is on that any type of medication that is associated with that, should not be really taking it on their own. They should follow the regimen that is given to them.
Oh, absolutely, and the careful monitoring of their blood levels and checking their liver functions as well as their kidney functions if they happen to be on aminoglycosides or any other therapy that might be impairing their kidney function.
I see. What role does access to funding play specifically in Africa regarding medical research?
Oh, a significant role. Access to funding really is one of the critical bedrocks for enabling any type of sustainable medical research in most of the African countries. And there are a number of them that are made available. Recently, the United Kingdom's Department for International Development joined with the Medical Research Council to support funding because they recognize that we need to provide this type of support to stimulate the interest in our African researchers, yes, to be able to continue research in Africa. So there are a number of them. There are a number of foundations that also give grants. The WHO, through many of its affiliations, including the Malaria Medicines Venture, etc., support research efforts around specific diseases, the neglected diseases, etc. So it does play a major role. I think one of the key issues is awareness. Are people aware that they have these opportunities? Are people aware of these funding and the access, and how to apply for them and where to go to get that information, I think is most critical.
So how do we increase that awareness in Africa then? Because again, as you just mentioned, these resources are there.
They are there.
But yet we still seem like we are in shortage of researchers there, in terms of both facilities and the necessary equipment that are needed for these researchers.
Yes.
So what are we doing wrong? Or what have we not tapped
into?
Yes.
Well, the various national governments have their different government offices, ministries of health, ministries of information, ministries of communication. And in today's world where communication is really at our fingertips, with just a push of a mouse, and you're exposed, you can Google and get a lot of information that's out there. I think the world has leaped ahead and leapfrogged past the issues of the past of poor communication and levels of awareness to a point where individuals can actually self-advocate, self-help themselves, be proactive, and find the levels of engagement and reach out to these resources, because I think most of them are posted on the various webs. And then, of course, providing that information within the country, or those members of the ministries that actually attend conferences outside of the country, bring back that information and, broadcast the level of awareness and interest within their country to make sure that they participate in some of these opportunities.
I see. Let me switch out a little bit. Cancer.
Oh, yes. Cancer.
Correct me, cancer is not infectious disease.
No, it's called genetic, non-communicable.
Non-communicable,
yes.
Okay. Of recent times, Africa is finally catching up that cancer does exist. Yes. And we're seeing more cancer. We're seeing breast cancer.
Yes.
Before they call it something else. It's not diagnosed as such. They're more of into calling it fetish issues. But why now?
Well, cancer worldwide, the incidence of cancer is increasing all around the world. There are many factors that are contributing to this increasing incidence of cancer around the world, including lifestyle changes, mobility, changes in our foods, etc. And Africa is not alone in this. The There's been a lot of migration, as you know, movement from the hinterlands into the urban areas, changes in lifestyle, exposure to tobacco use, increasing promiscuity, different foods, etc. So there's been a lot of increase in the incidence of prostate cancer, cervical cancer, breast cancer, and lung cancer. And a number of these can be attributed to lifestyle changes to the most part. Now,
nutrition being one of them.
Nutrition is a major aspect of some of these cancers. Obviously, the typical not just the cancers, but when we talk about the non-communicable diseases, if you think about them, cancer is the leading one that causes death, but we also have cardiovascular diseases like hypertension and strokes, which are in high order in a lot of the developed and developing countries. And in the developing countries, it's gaining momentum again as the lifestyle changes, the foods change to more processed food from the organic, vegetables. As people get more the life gets more automated. There's more sedentary lifestyle from the previous movement and active lifestyle. So there are a number of factors that are really leading to an increase in the non-communicable diseases, as well as dealing with the communicable ones that we've just been talking about.
Yes. Yeah. So for somebody that is watching out there, in terms of, I want to really get in with the nutrition aspect of it.
Yes.
Africans, we naturally eat well. However, that has changed.
That has changed, yes.
What would you, in terms of nutrition,
yes,
recommend? I know there is no one particular answer to eradicating the disease or even curing it. But what can one do to improve their lifestyle in terms of both nutrition and environmentally to at least curtail the possibility of diseases like cancer?
Well, the nutrition part, not claiming to be a nutritionist by any means, the non-communicable diseases that we want to focus on, which includes cancer, includes cardiovascular conditions, as well as diabetes. And if you think about diabetes, there's a strong association between diabetes and nutrition, as well as mobility, how active or how sedentary, and as well as the cardiovascular conditions that lead to hypertension and strokes. So high fat content meals, high caloric content meals, the processed foods, and not focusing on the right types of oils if we're going to be taking in any of the fat content, the omega-3, the right types of oils would be the appropriate ones for us to focus on. The African nutrition ordinarily has a lot of high fiber, high vegetable, organic foods, and non-processed foods.
Right.
But with the Western style and adopting that lifestyle, people are moving more to the processed foods, high-fat content foods, sausages and bacons and things that connote a good lifestyle, but in fact has changed, what would have been considered our indigenous type of diet. Then, of course, activity, physical exercise, and movement, so I think all those can help.
Well, thank you so much, Dr. Ukwu. You have been very informative. Again, it's been a pleasure. I'm hoping to have you back.
Thank you.
To talk more about other diseases, especially within the infectious disease, so that we can actually take them one by one and educate our viewers.
That would be my pleasure.
On ways for us to help, at least socially, help ourselves to curb some of these diseases without necessarily taking medication all the time. No offense to the medical professions. Again, thank you so much.
Thank you very much for having me.
We're glad to have you at Africa Express. Thank you so much for watching Africa Express today. You have been watching Dr. Henrietta Ukwu talking about infectious diseases. Please do stay with us on this channel for another intriguing topic. Thank you for watching Africa Express.